A group has organized a men-only one-day retreat to help address mental health challenges and reduce the suicide rate among men. Experts during the retreat also called for more discussion around mental health issues affecting men. We have details in this report.
According to the World Health Organization, mental health conditions include mental disorders and psychosocial disabilities. In 2019, 970 million people were diagnosed with a mental disorder, with anxiety and depression being the most common. The WHO also says people with severe mental health conditions die 10 to 20 years earlier than the general population. Conversations surrounding mental health have always been held with skepticism and disbelief.
We're creating a psychological safe space where men can come diverse. They talk, they have conversations, we have psychiatrists coming to speak, we have a social worker coming to speak. So all of this is what we're doing to make sure that we have a better society. And of course, research also shows that when the man is whole, the home and the children are better. We're giving tools here today to help people understand, or tools to identify and then navigate emotions and all of that.
Men seem to offer themselves a lot for their families, offer themselves a lot for causes, but most times they do not do anything for themselves. So the idea is for us to bring men together and help them find a way to begin to reach deep down inside of them to provide succor for themselves.
The symptoms for mental disorders are sometimes subtle, other times too hard to ignore. But for the National Institute of Mental Health, some of these symptoms include anger, changes in mood, abuse of alcohol and drugs, difficulty in sleeping, or sometimes excessive sleep.
As men, we need to really talk about mental health, right? Because once there are stereotypes around it, once you talk about it, there's just some controversies around it. I'm here to listen to conversations and hopefully learn really well about this issue.
When I heard the topic, I was like, hey, is there something like this in Nigeria? Because like this is the very first time I'm hearing something like, I want to take care of men's mental health. We always take care of people, and nobody think about men.
With the calls for focus on men's mental health increasing, the hope is that more attention will be drawn to the emotional challenges faced by men.